breaks that kind of just kept running. We try to tailor those for each segment, and sometimes they roll through and we have to get through it. But right now, Alexandria will join us on the show, and really one of my favorite partners has always been Centerstone, because really just you can never have a better opportunity to help somebody and really get this information out there, because you never know when you're going to need it. And I think it's so important. Alexandria, thank you so much for coming on the show today.
I'm very glad to be here.
And thank you for hanging out with me during that monsoon of commercials I hit you with.
Hey, I'm always working on staying cool and being patient.
That sounds good. Well, we're talking RCORP today, and this is a really great opportunity, a great program. And really, let's just dive right into this. Take me through your role.
So I'm the clinical coordinator for RCORP. Which stands for a Rural Communities Opioid Response Program. It's a federally funded grant program, and don't let the title of it be misleading, because each RCORP grant is unique. And the one we sponsor at Centerstone is for school-aged children and their families. Our theory is, if children receive the mental health support they deserve at an early age, they are less likely to engage in substances. So it's a mental health or behavioral health program, and it allows kids to connect with counselors via telehealth.
This is really, really important, because I could only imagine, and we've had so many conversations, Alexandria, with Centerstone and really just others in the healthcare field that talk about that disconnect when it comes to rural living and just the access there to, sometimes it could be healthcare and other health services, but just being able to have that telehealth. And also, I know that sometimes opiate use and some of those things do become a little bit more prominent in some of those rural areas as well. Is that correct?
That is correct. The service area we provide services in includes 11 counties in Illinois. And the reason those counties, which I'll list in a minute, the reason those counties were selected is due to the high rate of poverty, the high rate of opioid usage per capita.
Gotcha.
And the other reason is due to the low level of access to mental health, particularly for children.
Right.
And I should say youth, because we work with folks 3 through 18. And the other nice thing about the program is that we also provide services once we engage a school-age child or youth in the program. We can work with any family member.
Oh,
siblings, mom, dad, grandma, cousins.
Wow.
And the counties we serve include Bond, Calhoun, Clinton, Franklin, Greene, Macoupin, Montgomery, Perry, Saline, Washington, and Union.
Wow. So, I mean, those are about as rural. I mean, you're right. I mean, that really does incorporate all of what that mission statement's about. And what I think is so important, though, you hit on two things before we dive really into more of the aspects. Just something so fascinating was that once the child's, under your guys' umbrella in this, you can take the family members, those loved ones along for the ride. And because it really is this encompassing care, and it starts at home. And I think that that's such an important thing that you guys are tackling, because the more that you can address these circumstances, not situations, but just things that are happening in life at a young age, and really kind of develop those skills, you're really creating a positive snow globe effect for the rest of somebody's life.
That is our entire goal, recognizing the fact that if we're able to build coping skills at a young age, then we're able to use those skills throughout our lives.
Right.
And one of the reasons that young people are frequently in the situation they're in is because their parents didn't receive the support they deserved when they were young. And that's part of the reason we would like to provide that support for family members now. The other reason is because, everyone exists within a larger system. their family, their school, their community. So we really want to provide the resources to support folks, not only as an individual, but as a member in a larger community. So we also offer care coordination services so that we can help connect the individual and their families and our community partners with additional resources.
Well, and
for instance,
oh, sorry.
I apologize. Didn't mean to cut you off.
No, please keep going.
But one of the things is that, telehealth is fantastic, but if you don't have a way to connect with telehealth services, then that's a pretty big barrier. So we develop community partnerships with schools, libraries, hospitals, health departments, and we can provide telehealth equipment for individuals to connect with our services.
That's incredible. I mean, that truly is incredible because sometimes, and that's, I think, the public thought, just from what we observe here is, you hear these great programs and it's, making sure the individual actually has access to those as well. So, and making sure they do have access to telehealth, even though that service is provided. So that's great to know that you're going above and beyond and making sure that that's there, and I think that's just so vitally important.
I would agree. And I think that one of the wonderful things about programs like RCORP is a recognition of the types of barriers people face in reaching the care that they need. Mm-hmm. For instance, another barrier we're working to address is mental health stigma. If you fall and break your arm, no one would ever fault you for going to the doctor, right?
Right.
Well, when it comes to mental health, people are like, well, if you see a therapist, such and such is true of you.
Right.
And really, caring for your mental health is as important as caring for your physical health. Oh. And there should be no stigma related to talking to someone.
Well, and that's I think, so not to cut you off, Alexandria, and that's why I think it's so important that we do these segments with Centerstone and we have you guys on and we keep talking about this openly on the air, because the more that we can discuss it publicly on airwaves and in media, and you guys institute your programs and you bring those to the young schools. And just like in Madison County, they're doing some teen mental health first aid in some of the elementary schools where we can, really just start to understand that this is a part of life and there's nothing to be ashamed of or poke fun of or bully over.
Completely correct. I think that it's really important to recognize that everybody has mental health challenges. It is just part of life. Mm-hmm. Life is hard, right. Particularly right now.
Right.
And everyone has challenges related to that. Stress is at an all-time high.
Yeah.
And we as adults may have developed coping skills to address those things. But just like you take your car in for a tune-up, we as adults could use a tune-up with the way we handle stress.
100% agree with you. And, and that's why I think, too, it's just going back into this program a little bit more, because like you said earlier in the first part of this conversation, to help, the older adults, kind of cope with some of that as well once their child's involved in the program. Because it takes a village, and they didn't get those skills when they were growing up. And I think that's why this is so important, because across the board, you're destigmatizing as well, because we can talk about it and we can all say, the phrases and things we want to say all the time. But until it's instituted like you guys are doing, it really does break that barrier, Alex. And I think that's such a priceless component of really this program. That's huge.
Well, and I think that one of the other things to think about is, the way we handled things 10 or 15 years ago
for sure
is so different from the way we can handle things now.
Right.
There are so many things we know more about, and we have a greater understanding of how to support people on a daily basis. Mm-hmm. Just to give you a small example, when you think about a positive memory, when a positive memory gets stored in the brain, it gets coated with, let's just say, paint. It has to do with neurotransmitters and things like that, but we don't need to get into the science of it. But if we think about the fact that the paint that a positive memory gets a bright and cheery color, pick a favorite color.
Blue.
There we go, blue. It gets painted with blue and it gets stored in the brain.
Mm-hmm.
Then when you have a negative memory, it not only gets coated with neon brilliant blue, but it also gets its own neon light. So when your brain thinks about memories, it goes to the negative ones before the positive ones.
Wow.
Now, originally, negative memories, anxiety, and stress, these were all used to help us stay alive. Back in the days when we had to watch out for saber-toothed tigers.
True.
But these days, we don't have to worry about that.
It's very true. That's very true, too.
But our brains have not significantly changed in the way we store this information.
Right.
As a result, it's important for us to be able to store up more positive memories and have strong coping skills for dealing with the negative memories.
This is really fascinating, Alex. I mean, it really is. And I think that that's such a big thing because how many times, I mean, you know this better than I do, but a lot of problems start from, those one or two negative memories that maybe have imprinted or back there. Then it's followed by a couple of thoughts that are followed by anxiety, or maybe you're adding on or grandiose in the negative thought, or maybe creating a false reality. All that stuff happens with it. And then you have yourself in a pretty significant issue.
Yes. For many people, when they talk about, things like, I always wanted to be a writer, an actress, a teacher, but this one teacher told me in first grade or third grade that I could never amount to anything.
Mm-hmm.
And because of the significance of this experience, people make life choices that really affect them.
It's true. That's true.
And, historically, as a society, we thought, okay, we make a life choice, we build a career around it, and we go from there. But the reality is the average person makes career changes 3 to 5 times in a lifetime.
Right.
So this idea that, well, it's too late now, I say better late than never.
That's a good point.
I mean, the oldest undergraduate who graduated with a BA was 98.
Right. Well, and see, that's the thing. And whenever you surround yourself with those positive and people, and like we've just talked about with your work, it's like, well, that's because of such and such, and I just can't do it. And it's because of those negative connotations and all of those things that really are what you guys focus on here in this RCORP. And I think that that's so important because as an individual growing up, especially for these kids now, I feel so bad for them in the social media age and everything that could happen with it. I mean, you're constantly under a microscope in so many steps of the imagination because you just are out there. So to develop these skills and really with all of these things that are happening in life and innovation, it's not just important, it's kind of crucial really for the development of anybody.
Yes, that is very true. The higher incidence of mental health challenges in the dynamics of school-age children is really reaching pandemic levels.
Yeah.
We have a lot of kids who need the support to deal with bullying, whether it's in person or online, who need to develop a strong sense of self and to not feel that they have to respond to these pressures to change or conform. And a lot of families are also dealing with additional stresses in terms of finances and other, the housing market is very challenging right now as well.
Yeah.
So not only having support for their psychological concerns, but also helping them connect to life skills parenting, adulting, which is a term we didn't always use, getting connected to resources for housing, healthcare, education, all of these things. We're here to help.
Well, and see, that's what you read right into my hand here, because we have a couple of minutes left, and I wanted to make sure that our audience knew a little bit about what your care coordinators here with RCORP are here to help you with. And I mean, I was just going through this list, Alexandria, from money management and loans to affordable health care help to health management, life skills and community support, child and elder care, vocational training and employment, the substance use disorder treatment, the housing, the utilities, the care transitions, and all the other things. It's every one of those aspects is really vital for what your guys' mission is, because you can't have the success without the other steps on the rung there, if that makes any sense. You have to have all those pieces of that puzzle.
One of the ways to think about it is that for us, counselors are your life coach, your support team. And most support teams include multiple members. And when we think of an individual as they fit into a larger community, we need more people on the team.
Right.
And so a big part of what we do at RCORP is connecting individuals to their larger team and making sure that they're aware of all the support they could have if they were connected to the right resources.
This is just really, I'm so glad we're talking about this. What a great program. And wanted to ask you before I let you go, just because I saw this flyer and wanted to make sure I asked, is there an invitation for schools to join RCORP?
Definitely. We are very interested in working with schools. We partner seamlessly with their support system, whether it be guidance counselors, social workers, other members of their support team within the schools. We can create a partnership, talk about building telehealth resources, and connecting families to community resources.
This is great. Well, and Alexandria, before I let you go, it was great talking with you, and I really appreciate your time. What is is there anything else that you'd like for the public to know about RCORP or some of the other spokes of this wonderful service? Because this has been more than a fascinating conversation, and thank you for that.
Oh, thank you for the opportunity to talk about it and to spread the word. We just want to let everybody know that we are here to help, and our goal is to help each individual who connects with Centerstone to have a transformative experience so that they can thrive.
Really cool. Alexandria, we'll link everything in an article on RiverBender.com. Thank you so much for joining us today, and thank you all at Centerstone for the great work you do.
Likewise. Have a great day.
You too. We'll take a quick break. More Daily Show on this Wednesday morning happens next.